this Meet the Governor candidates of the contested election for Warwickshire and Leamington towns. The meeting will be recorded onto our YouTube channel and will be available on the Trust website. We have a chat box function for those of you who are familiar with the way MS Teams work. And so if during the course of this evening you want to ask any of the candidates a question, if you can use a chat box, it will just allow me to manage the meeting efficiently. Each of the candidates will have a maximum of 5 minutes to introduce themselves. In the previously circulated pack, each of the candidates had made their case for election, but their 5 minutes will probably cover the key points from that, as well as any other points they would like to make. So we were expecting some candidates not to be able to join us, but I'm delighted that Nyedi is first up to welcome herself. So Nyedi, over to you. Nyedi, you're on mute at the moment.
Yes. Hello, can you hear me?
Yes, we can.
Okay. Good evening, everyone. Very nice to be here in the meeting. My name is Nyedi Kunkwo. I am a medical doctor and a public health practitioner. I am also a fellow of the Royal Society for Public Health, and I'm contesting for the position of governor. Yes. So the reason I want to be governor for the trust is because I'm very passionate about community health, public health, and, supporting the movement, really. I've got experience in health protection. I've got experience in research, and I know what it means when people don't feel heard in their community. So being a governor is really an opportunity for me to kind of bridge a gap, volunteer my time to bridge a gap between the community and the trust. There are people who receive services from the trust who have some complaints they would like to table, but they don't know how to go about it. They don't know who to talk to. There are also people who would like to, speak about certain things that they would like the trust to do. But sometimes they don't know where to start from. So being a governor is really an opportunity for me to say, hey, I'm here. I'm the one representing our community. If you have any need if you have any worries or concerns about the trust and how it functions, feel free to talk to me about it. Then I can table this, I can bring this up with the trust, and we can, sit together to find a way around it. I think it's also an opportunity for me to be in a position of leadership, where I get to contribute my voice, where I get to contribute, my knowledge as well, to help the trust, to function properly. I believe being a governor does not restrict me from, partaking in the activities of the trust, basically. So this is an opportunity for me to get involved. It's also an opportunity for me to learn about how the trust functions, to learn about how a hospital works. So the South Warwickshire University NHS Foundation Trust is huge. It serves 4 hospitals, and this is a wonderful opportunity to get involved with the community. I was previously living in Birmingham. I moved to Leamington about a year ago. I know that sounds pretty new, but I'm not somebody that likes to be laid back. I like to be involved. I like to know what's happening and, volunteer myself to really make a difference. So this will be an opportunity for me. I don't see a lot of people like me in this position. I don't see a lot of people like me who get the voice to speak. So it's really an opportunity. Like I said, I'll be representing a whole community, people in the minority groups, people who have not been able to speak out, really. This will be an opportunity for them to get their voices heard. And being very passionate about public health and knowing what it involves, it's really something I like to be part of. Public health is my passion. I believe there's so much to learn in this position. Thank you.
No, thank you, Nyedi. Next up is Christopher King. Christopher, you've got 5 minutes. Over to you.
Thank you. Good afternoon. You'll have seen from my prepared piece that I'm a Warwick District Councillor. I live in central Leamington, and my ward is Clarendon Ward in Leamington. I've lived here for 20 years. My wife is at Warwick Uni. I think I've had a lot to do with the health service. I had a heart transplant 15 years ago, and I went through a lot before that. And my experiences have shown me with the health service what a remarkable service it is. And I think in this, I don't have any medical training, but I might be able to give something back by helping out with the kind of work that you do in a sort of, I see it in a sort of ambassadorial role, bringing the community in and helping people understand better, showing people how better to better use the health service, but also trying to help people understand why it is such a tricky thing to organise. There seems to be the constant narrative in the national media about the stresses and strains of the health service, and it tends to come over negatively the whole time. I think the actual living with the health service and having the involvement that I've had over the years, there's a different side to it, and I think it's important for people like myself, but anybody in this, with the links that I have in the community, to try and bring that argument to more and more people. I think that the range of experiences I've had as a career before I became a councillor, I was in construction for a long time. I've worked in many different countries. I've even worked as a cook on a merchant ship for 2 years. I've done so many things, and I feel that there's that kind of range of experiences has given me very good communication skills, not so much with my own peers, but with the range of people that one meets in all walks of life. And I think any opportunity I would get to help broadcast the value that the health service brings to the community, I'd like to take it. I think the role of the community health service as it grows within our community is really important. I'm sure all of you know the recently opened Leamington Community Health Centre, which is doing a really valuable job. And I think one of the things I didn't mention probably is that I have the planning portfolio for District Council. And I can assure you, with all the work we're doing at the moment on the South Warwickshire local plan, getting justification to build community centres, but also health centres in any of the areas where we're having to look at building large numbers of houses, which is going to be the case for the next 30 years, is something which I understand is really important, to make sure that people have access when they need it easily to any kind of healthcare that they need, and then can be passed on to the bigger hospitals if necessary. So it's really the fact that I think my position at the moment as a councillor brings me into contact with a wide range of people all the time, and I'm volunteering, I'm knocking on doors, of course, and talking to people a lot of the time, and I think that puts me in a good position to try and put the arguments around the health service and try and get people to understand better how it's working, its difficulties, and of course how they can help it to work better by understanding better how to use their services. So that's really my thoughts today. I hope that's helpful.
Thank you very much, Christopher.
Thank you.
Next up is Carolyn. Carolyn, over to you.
Good afternoon, everybody. You'll see from my initial address that I've lived in Leamington with my family since 1977, very much part of the community. I've been a governor for the last 3 years, and I loved it. I've loved it, and I would like very much to serve another term. The contacts I've had with SWFT staff, both medical and administrative, in person and in meetings, have taught me an enormous amount about the work that they do and the dedication that they show. I have the utmost admiration for what I've seen on observations and audits in the hospital. It has been very interesting and informative, and I have learned so much. I'm now a member of the patient participation group at Clarendon Lodge Medical Practice in Leamington. I believe that serving as a governor and being on the PPG is a useful, sensible and powerful combination for the good of our community and for both GP and hospital care. One of the functions of being a governor is to provide a link between members of the public and the hospital trust. In order to do this important work, I have become a member of the Health and Wellbeing Steering Committee, which oversees the work of the Leamington Health and Wellbeing Hub, as well as similar hubs in Stratford and Shipston. I visited the Leamington Hub this Monday, and I was so impressed by the work they're doing in an area of South Warwickshire, which has fewer advantages than most others. This hub offers various clinics, including speech and language, dental care on referral or for emergencies, paediatrics, help with long COVID and respiratory infections. It provides office space for district nurses and also meeting rooms for organising wellbeing walks and exercise sessions, drop-in advice sessions for young people and various other community needs. The work of the steering group, of which I'm presently a member, is to support all these services, to assist the hub to make informed decisions, to support the addition of appropriate new schemes at the right time, to present business cases for other services. This work will assist the Trust in diverting services from hospitals on the basis of helping to promote health and well-being and to make services more accessible for the local community. I would like to continue to be a governor for all these reasons and because I believe I can prove some continuity from the experience I have had over the last 3 years. Thank you.
Thank you, Carolyn. Our next candidate is Michael Cox. Michael is unable to join us this evening. However, his candidate statement is available in the voting pack and information shared ahead of tonight's meeting. Sandra Cox, MBE, also I think is unable to attend. But again, Sandra's candidate statement is available in the voting pack. But I'm delighted that Leslie McGuigan is able to join us. So, Leslie, over to you.
Leslie, you're on mute. You're on mute.
Leslie, I'll try and take you off. It's okay. Bear with me. For some reason, I'm not able to unmute you. I think you need to unmute yourself at your end, Leslie. Otherwise, your dulcet tones will be lost on us.
Leslie, you could try leaving and rejoining and seeing if that enables you to be off mute.
Do you want to try that, Leslie, and we'll wait for you. Okay. Hopefully see you in a minute. And just whilst Leslie's leaving the meeting, actually, I'm just wondering if we can help Leslie leave the meeting. So
yeah, I'll remove her from the meeting and then she can rejoin.
Back in. Our final candidate is Kevin Smythe. Kevin is unable to attend this evening. However, again, his candidate statement is available in the voting pack. Just filling time up whilst hopefully Leslie rejoins us. We have therefore 7 candidates for Warwick and Leamington District, of which there are 4 available governor positions. So 7 candidates, 4 available positions. Just hoping Leslie's going to pop back up in just a second.
It's Mr. King here. Can I ask a quick question?
Of course you can, Christopher.
When I've given my statement, do we stay online with the meeting?
Yeah, no, if you can stay online, just in case members of the public want to ask any questions.
Right, fair enough.
Thank you. Patience is a virtue I've often found in life, but not one I'm predisposed towards. So we can just hope that Leslie comes back.
We're just resending her the link, Russell, because we can't actually invite her in.
Nice to see old friends on the call, Jane and Roger.
Thanks. Well, I'm sorry I was late, but I didn't know I could make this meeting, and I think I've missed some of them. I've missed Chris King. And has Neddy spoken?
Yes, she has, and so has he. So Jane, but their voting statements are available in the pack, and Leslie is just arriving back. Leslie, hopefully you're still muted. Is there any Leslie? Leslie, perfect. Perfect.
Excellent.
So
Right.
Leslie, over to you.
Sorry for the delay.
No
Hope
problem.
it was worth waiting for.
No problem.
I'm a retired secondary school head teacher, so I'm very much aware of the issues of managing a large and complex organisation. Clearly, mine wasn't as large as the trust. I'm a passionate advocate for the NHS, and I dated today my very first action to support the NHS, which was in 1980, when I took strike action to support healthcare workers in requiring a pay rise. My daughter is also an occupational therapist and has worked in hospitals for 10 years. So she gives me a great deal of information about the day-to-day workings of hospitals. So why do I want to do it? Well, I believe all governing bodies, and I've served on several, need fresh eyes and new ideas. They need to have people who look at different ways at looking at opportunities and at problems as well. It's too easy just to settle for the norm. And over the last 10 years, I've accessed services across the trust on a regular and almost monthly basis. My husband was admitted frequently to the hospitals and was on almost every ward in Warwick, with the exception of maternity. These regular visits allowed me to listen and observe, and I was able to ask the staff what they would like to see change. And as a governor, I would hope to represent a broad spectrum of those involved in the trust and to push for the best possible outcomes for both patients and staff. So why now? Why do I want to do it now? My husband died 8 weeks ago, and I have to say the end of life care he received at Warwick was exceptionally good and compassionate. So now I feel it's my time to put my experience, both as the head of a large comprehensive and also the recipient of hospital services, to use. I'm also keen to see how the trust is going to implement the new plans that the government have put in place, particularly on prevention and community services. So, in summary, I believe I've got the energy, the experience and the commitment to be a valuable governor for the trust.
Thank you very much, Leslie. It was well worth the struggles of coming off mute to him. So this is the opportunity for members of the public who are on the line. If you want to ask the candidates any questions, I will facilitate that. I can't see anything in the chat box, but if you want to come off mute or raise a physical hand, I'll come to you to invite you to ask all the candidates any questions you might have. Jane Knight. Jane, you're on mute.
Yeah, I just thought one of the most, I'm retiring, as you know, from being a governor, and it's been a very interesting experience. But I've always found the engaging with members of SWFT, which is so that we know what they're thinking, and bring it back to the board and so on. I found that one of the more difficult things to do, and I wondered if some of the candidates have any thoughts about how they would engage with their constituency.
Okay, thank you, Jane. So I'll go to Nyadi first of all. Nyadi, how would you aim to address the challenge of effective engagement with members of the public?
Yes, thank you very much, Russell. And thank you, Jane, for that question. It's a very important question, actually, because at every point we need to know what the feedback from the people are We need to know if they are happy with the services they receive or if they need things to be improved. So how do I want to do that? How do I want to help? Currently, I am a member of the Labour Party and I'm very active. I'm also the Equality and Diversity Officer, and I go out to canvass a lot. I knock on doorsteps every other day, and I speak to people on a physical level, one-to-one, hearing their thoughts and what they would like to be changed about certain issues. So I think this is really one of the things I can include in what I'm already doing. It's a wonderful opportunity for me to get to hear them one-on-one, to feel, what they're feeling, and then to take this up to the trust and discuss these issues on a leadership level and get it sorted. So that's how I'll be doing a lot of canvassing, knocking on doors. I'm also going to be on social media. Being a young person, I'm very versatile with social media. I use Facebook a lot. I use Instagram, and I'm very active. So I'll be putting out a lot of information, allowing people to talk. It's going to be interactive, really. And I think when I do that, and even on the road, I'll be able to, if people stop me on the road and want to ask a question, I'm happy to stand and talk to them. So these are the ways I think it's just effective communication, basically, and I hope to really do that. Thank you.
Thank you, Nyedi. Christopher, how would you go about that challenge?
On the cabinet in district council, a good friend of mine, but also a portfolio holder, is Councillor Jim Sinnott, who has the portfolio for health and care and safety in the community. And we talk a lot, and our work overlaps a great deal. And it means then that I speak to him quite a lot about issues that he encounters with people in council housing and people in private housing who are having issues and are struggling for all sorts of reasons. And in that context, if you like, whether I like it or not, I come up against all sorts of people who are having issues in society, not necessarily, of course, in issues in the community, not necessarily always or constantly with the health service, but as you could appreciate, with the age profile that we are frequently in contact with, that is an issue. And there's also an issue right across the board, but the elderly people living on their own, for example, is something which Jim is very concerned with, and we speak about those things a lot. So I think in the nature of what I'm doing every day, and there's a lot going on, as you can appreciate, I think I'll be able to cover that pretty effectively. Thank
you, Christopher. Carolyn.
Yes, I agree with Jane. It is quite difficult to connect with members of the public. Certainly since the pandemic, as I understand it, there was much more connection before the pandemic. But I think with the two things that I've got now, the PPG, I've got, if you like, almost a spokesperson role there on behalf of the public between the GP and the hospital and to deal with any other issues that there are. But specifically this wellbeing hub in Leamington, I think it's going to be a very, very good opportunity of getting to know the public, getting to explain to them, to us, I should say, what is available and how they can take any issues to the trust in order to resolve them. And there may be other ways of connecting with the public as well.
Thank you, Carolyn. And Leslie.
I think my experience has been simply sitting on hospital wards, sitting in surgeries and listening to what the patients and their visitors are saying about the service they receive, how it could be improved, and the things that they found very helpful. I think I would have to work on possibly developing other ways of doing that, as I haven't been out canvassing as some of the other candidates have. But I might be interested in developing a better IT service that people at the end of surgeries, whatever, could click in to say what they have felt and what has been beneficial to them. But I'll be here to learn.
Okay, thank you, Leslie. Any other questions from members of the public?
Russell, might I just come in again, because I did take part in an audit of the emergency department last year, and that was an excellent way of contacting the public. We asked them some questions and we got some very interesting views. Sorry to interrupt, but I thought perhaps I should just add that as well. And we are doing an audit of the outpatients department this year. Thank you.
Thank you, Carolyn. So Gareth has asked a question in the chat box, which I'll just read out on his behalf. I'm an electric wheelchair user in Warwick. I work part-time and volunteer at Stratford RFC. Knowing now personally how time poor most people are, how much time could you commit to the role? I guess a current governor might need to suggest how much time is required of late first. I think just on that second bit, if I can answer that first, Gareth, as you've asked the question. What we've generally found, we've had a council of governors now for well over 10 years. And we find that some governors really do get involved very actively. And some governors are a little bit semi-detached. I would always encourage governors to get involved very actively, like any volunteering work. You know, there are the formal meetings, and you're invited to be on subcommittees of the Council of Governors. But I think if you were to dedicate or think in your own mind of at least 2 days a month, that would be roughly the sort of minimum time commitment to be effective. But for some governors, it's more than that. But just coming back to your question, how much time could you commit to the role? Nyadi?
Yes, thank you, Russell. Thank you, because it's an important question as well. I mean, there's no need being a governor when you're not going to be involved, when you're not going to make time. So basically, I'm going to be involved, and this is something I like already. It's something I'm passionate about. I'm passionate about community building, community health, health protection, public health. It's my area really. And of course, I'm going to make time. I'm willing to make time as often as possible to be out there, reaching out, you know, interacting, attending meetings, you know, and all. Definitely, you're going to see me really working and being active. I'm not going to be dormant, basically. So yeah, I'll be involved.
Thank you, Nyadi. And Christopher?
Well, I am retired, but give my time freely to being a councillor. But a lot of that commitment is in the evenings with meetings. So my daytimes are, I can choose to fill them with work around that, and I can see that 2 days a week, 2 days a month would, by and large, be doable. I'm sure that isn't around fixed meetings every week, and I'm sure that there are options to plan ahead, you know, with good planning and forward thinking. A lot of things can be fitted in where the will is there. And I think Neddy's point was a very good one, is that there's not a lot of point applying for a post as a volunteer in any kind of role if you're not prepared to get with it and understand that it's a community job being a volunteer. There's no point doing it as a one person. It's really important to work with others and support other people who are doing the same thing, and you can become much more effective that way. And that's, of course, something which in any kind of volunteer work is true, but and certainly what I'm doing at the moment is a major part of what I do. So I don't see that being as an issue.
Thank you very much, Christopher. And Carolyn?
Yes, I agree completely with what the first two have said about there's no point in being a governor unless you're prepared to give wholehearted support to it. Likewise, I am retired and not in paid employment, so my time is my own in a way. I actually sit on 2 committees and observe on 3 other committees, and I don't find it onerous at all. Part of the ease of it is because most meetings are virtual, and while they do have their drawbacks, they're also very easy to go to, so that you don't have to travel and you're just back at home and taking part in the meetings. It's as broad as it's long, whatever you want. But I would say definitely, if you're going to be a governor, you need to do it wholeheartedly. And I hope I have done over the last 3 years. I feel that I've done reasonably well. Could do better always, but I've done my best.
Thank you, Carolyn. And finally, Leslie?
I think if you're passionate about something, you give your time freely. I say it just would not be an issue. And as I've already said, my responsibilities of care, which was for my husband, have ceased. So I will have plenty of time to support.
Thank you, Leslie. And any other questions from members of the public? Hilary.
Thank you, Chair. In my life, I have managed volunteers a lot, and a question that I always found was important was, do you want to change things? And so I think I would ask the candidates, actually, are they wanting to change things? I think we've heard the enthusiasm that they have, but it is about moving on and making a difference.
That's super. Thank you, Hilary. So if you like, your appetite for change and desire for change. And the AD?
Yes, definitely. Thank you, Hilary, for that question. Yes, I hope to bring about a change. It might not be elaborate, it might not be the biggest change in the world, but I really hope to be somebody that can bring up issues that matter to the community, to the people who use the trust services, to the table of the leadership of the trust. If I'm able to do that, if I'm able to do that consistently during my regime or during my time or tenure as a governor, I think that will be making a positive change in the right direction. Just getting the voices of the people in the community heard, it can really make a difference in how the leadership, the trust leadership, strategizes their policies and, reimagines their plans and the way they serve the public. I think that will really matter. So I look forward to making that change, that level of change at the community level. I look forward to also making a change or being a voice to the leadership of the trust, being able to decide with the fellow governors, of course, who the leaderships would, the leaders of the trust would be, who the directors would be. I think, of course, we're making changes, definitely. And that's why I really want to be a governor. That's why I want to be part of this, because it will allow me the opportunity to make a change. Thank you.
Thank you, Nyadi. And Christopher?
The health service has been around a while, and all the time it has to change. Change is a process which you can't duck, and particularly, perhaps more so now than ever before, with the advent of AI and all the other changes around us, societal changes, the use of the internet, of course, which we're hopefully getting used to now, but also social media, massive change. And there are big movements in society all around us. And if the health service doesn't embrace change and indeed lead on change, it won't be doing its job. It won't be able to answer the needs of a really fast changing society. I don't think there's any question about that. And anybody that would challenge the need to change is not looking in the right direction. How that change occurs and bringing along people with you on a mission to change is a tricky thing. But I think anybody that's worked in any kind of politics understands that if you don't bring people along, you won't be able to bring change along either. So consulting, arguing and building the good arguments and doing your research and getting your data right are all fundamental parts of change, but we have to change and we have to keep changing.
Thank you, Christopher. And Carolyn?
Yes, I agree about change, and I think the health service does have a good opportunity now to change for the better for both patients and medical staff. And one of these changes is the emphasis on community care and prevention rather than cure, which I think is extremely important. People are much happier if they're not ill and are leading a healthy and happy life. So that's certainly one change I think that's going to be very, very interesting and important in the future. I think the digital change and the virtual change, yes, I think they could be very useful, and I wouldn't be involved in those because it's not my field. But I think if they're used properly as proper tools, then they could benefit everybody. And one change I'd like to see is, real respect and honour given to the medical staff who do such an amazing job. I mean, we talk about it all the time. They are really wonderful, certainly at Warwick Hospital and Stratford. So that's another change I'd like to see. Not perhaps the job of a governor, but nevertheless, anything that I could do to help that along, I would be happy to do.
Thank you, Carolyn. And finally, Leslie.
The reasons for change have to be understood by those people who are receiving the change and those people who are implementing it. And I think as a volunteer, I would first of all have to listen, understand before I leapt in to recommend any changes, because they need to be embraced and taken forward. And certainly, I think we're looking at a lot of new initiatives from the government coming forward on the NHS, and I hope that the staff and the patients will be positive about all of those, and particularly, as Carolyn just said, the community-based and the prevention rather than the cure.
It was a great question, Hilary. Not to say other questions weren't great, but it's the biggest challenge I think the NHS faces is the way it changes going forwards. But you're not interviewing me, you're interviewing the candidates. So any other questions from members of the public? Having said that, you're always welcome at the public boards to ask questions like that, and would very willingly give a reply. Okay, I can't see any other hands going up. So on that basis, I'll draw the meeting to a close. Now, the timeline from here, Sarah, in terms of voting for the candidates, and just a reminder, we have 4 available positions and 7 candidates. But Sarah, the timeline from here, please.
Okay, so the voting stage closes on Thursday, the 13th of February at 5 p.m. and then the results will be declared on Friday, the 14th.
Thank you very much. I would just like to thank members of the public for joining us tonight and for questions asked, but I'd also like to thank those who are standing for election. I wish all of the candidates well, and like the voting of a pope, the smoke will go up on the 14th of February, and I wish everyone well. In the meantime, take care and have a nice evening. Thank you very much for your time tonight. Bye-bye.
Thank you. Thank you.